So hi guys, it's Friday and I went to my appointment this morning very early. So I actually wanted to update a little bit. Last week, last video, like I mentioned, I went on my second ultrasound for the IVF cycle on Tuesday, and today I went to another appointment itself. Last Tuesday they mentioned that I had about 12 eggs, and out of the 12 eggs they were all very small. Now this week, if I look, I took a screenshot of what they said the sizes of my follicles were right now. Give me a second and I'll get it. So I have no idea if you guys can see it. I'll zoom in. So I had 10, 14, 14, 16, and then 10, 10, 12, 14, 14, 15, 16, 16, 19, 19. So I actually have 14 follicles at this time. So I also wanted to go over a couple of things. I actually brought my pharmacy here to tell you a little bit about what I've been taking. Like I had mentioned last time, I was taking Cetrotide, and I actually started taking that, and I promised you guys that I'd talk about symptoms if I was getting anything. One of the main symptoms I've noticed is that when I'm taking this, I'm really tired. Like I have to take a nap in the middle of the day. So I'm not sure if it's this, but it really did start when I started taking this, and I haven't done anything extreme this week. You know, not a lot of exercise, nothing that draining, so I'm sure it's the hormone. The other thing is, as I'm going to try to post a picture right now about the injection sites of the Cetrotide. When I inject it, it swells up around the area, so it looks like a little like a vampire bite or something, like a little bump. And it gets red all around, so it's normal as long as it doesn't go all over your stomach. It just goes in it's concentrated in the area where you put the injection, so it does itch a bit, burn a bit, and it has a little bit of a bump. So I actually brought a couple of things so I can show you what I worked with when I used the Cetrotide. So first of all, this is the syringe that they give you. It's usually filled up with the liquid. It's usually just sterile water. And they give you a little bottle like this with powder in it where you have to mix. So the first needle you use is the big needle. You just you have to put the alcohol swab, clean it, twist it, pull it out. Now, this is a scary needle, but you do not need to actually inject yourself with this. This is just to go into this bottle, and you put the liquid in, and you shake it up just a little bit like this. You pull it back in, pull it out. You actually pull it back in, sorry, I made a mistake. You have to pull it back in when it's upside down like this. So you pull it back in and pull it out. After that, you just put the cover back on, and you switch the needle to something way more friendly, which is just this little one here, which is not so bad, and you inject it into the stomach. So that was the needle for Cetrotide. I just wanted to show you quickly. I don't know if you guys, a lot of you guys are probably doing the IVF, but for those who haven't done anything, I want to show you the Perg pen. It looks like what you have when you have diabetes. So you have a little vial here. This actually has some Perg left in there. I'm going to take my last dose tonight, actually. I'm taking a dose of 100 units, which is actually very low for IVF. It's just I stimulate really well to it, and there's no need for me to actually go higher than that. So then you take the alcohol swab, you clean that area, you clean the area where you want to get, where you're going to put it in your injection. Then you take a little cover like this, you twist, and you can see it's a very tiny, tiny needle, very thin. I actually don't feel it much when I put it in. I really don't even feel much of a pinch because it's so fine. Then you have to choose what you want to put it at. So if it's at 100 units, you turn it to 100 units there. Now, if you make a mistake, don't worry. After that, you put it in and you can push it. And then you just inject it into yourself like that in your stomach. If you make a mistake, don't worry. You just kind of roll it out all the way, and then you can put it back and you can start over from the beginning. So this just kind of twists on, and you pull it off, and you have the little pin there. So I wanted to show you that. And I also want to show you all the other things that I'm going to be taking now. So my new cycle, I'm actually going to be doing the IVF on Monday, June 4th. That's going to be the egg retrieval, so I'm very, very excited for the egg retrieval. I'm a bit nervous about the pain, but because the HSG was so painful for me, so painful, so I was really worried about the pain. So they decided to give me, let me just make sure I take the right bottle. It's apolozapam, which is pretty much Ativan. They're giving it to me to relax. Some women were like, don't worry, it's not too bad, and you might want to stay awake to see the eggs, and honestly, I'm so nervous about that, I'd rather relax. So the Ativan are very, very little pills. Very tiny little pills to calm me down. They told me to take it one the night before the IVF, the egg retrieval, and one the morning of. So right now where I'm at is I'm going to be taking one more dose of Perg tonight, and I took a dose of Cetrotide this morning. Tomorrow I stop the Perg, but I take another dose of Cetrotide. It's my last dose, and at night I'm going to be taking the HCG shot, which is the same hormone that's given to you when you're pregnant. So if you take a pregnancy test, it's going to come out positive. I'm actually going to be taking 10,000 units, so which means I have to take 1 ml of this and mix it into this powder here, and then inject it into myself, into my stomach area. I can do it in my legs, but especially for the IVF, stomach area is always the best. They gave me a little kit here with an alcohol swab, the syringe, and again, 2 needles. The big needle to suck up the liquid, little needle to inject yourself. That I'll be doing tomorrow night. And that's the last medication, well, injectables that I'll be taking before the egg retrieval on Monday. Then on Sunday night, I take one of my Ativans, and I take my other Ativan in the morning, 2 hours before the retrieval. The retrieval is going to be at 10, but I have to show up at the hospital at 7:30. So after a 7:30, retrieval 10, and then they said I should be out of the hospital by 12, so obviously they want me to be able to go home. They said that they're going to give me some intravenous medication and also local anesthesia in the vagina wall, but the intravenous medication is just to give it. It's kind of like a morphine, but I don't think they're giving me morphine. It's something that starts with an F, and I don't remember the name at all. Then that day, they also told me to bring a bunch of other medications. So I have the Apodoxy tabs. Apodoxy tabs are pretty much I have to take with food, and they're to make sure I don't have any infections from the retrieval itself. So it's antibiotics. Then I have Estras, which is pretty much estrogen. I'm going to be taking that 3 times a day. It's kind of cute. I can't say medicine's cute, but I mean, it's a tiny, tiny, I don't know if you'll be able to see it because it's so small. It's the tiniest, tiniest little blue pill, and it's just estrogen. Used for pretty much just to raise your estrogen levels to make sure you keep the baby. The other medicine that they're giving me is Medrol. This is not a common medicine that they give. I mean, it is common, but they don't give it to everyone. It's a steroid that helps you, your body not reject the blastose, or the baby that's going to be implanted into you. It's just to avoid grapefruit juice, so I have no idea why. But it's a steroid. It just helps you not reject it. I have to take that 4 times for 4 days. And the last medicine is Prometrium. It's a vaginal suppository that I have to take 3 times a day, and luckily I'm not working now because every time I take it I have to lie down flat for 20 minutes. So that would have been funny if I was at my work and I had to lie down flat and say, oh, I'm just meditating. So I'll show you what it looks like. It kind of looks like a little pearl, like this, a tiny little pearl, and you just put that in vaginally, and I do that 3 times a day. So that's all the medication that I'm going to be taking throughout this cycle. I wanted to talk to you a little about what they're doing after the retrieval. So as soon as they do the retrieval, they're actually doing ICSI, where they take my eggs and they put a little glass tube and insert 1 sperm in it. The reason is because my husband doesn't have enough sperm and they don't want to take the chances, and they want to fertilize as many as possible. So that's what they're going to do. They're doing ICSI. And they're waiting 5 days before they put the fertilized egg inside me. So it should be on Friday. That should happen, and that will be. It'll be a blastose by then. So there's more chances that it'll implant. So I'm really excited about that. The other thing is. Yeah, I wanted to tell you about the video. I'm going to give you guys an update probably on Tuesday, because on Monday when I come back I might be a little bit of woozy or funny, so after the operation maybe a little bit of pain. So I'll give you guys an update, and I will keep you guys updated to tell you how the blastos are doing. I know the nurses will call me and give me an up-to-date every day saying, oh, these are fertilized, you have 5 surviving, 2 surviving, whatever. I'll keep you guys updated for that. I'm really excited to do this cycle. I'm a bit nervous again about the pain, but I promise to keep you guys updated, and have a wonderful weekend. Bye.